The government plans to vaccinate 15 million Kenyans, which is 30% of the country's population, by the end of the vaccination drive. Despite the World Health Organization coming to the aid of the Oxford AstraZeneca vaccine with its supposed side effects, there's still a low uptake of the jab in the country. The healthcare workers in the country were the first in line to receive the jab. However, only 20,000 people have been vaccinated against the virus. The county government are now a worried lot, with only few healthcare workers within the devolved units have taken the vaccine. The Council of Governors before the Senate's Health Committee virtually said that the misconception surrounding the vaccine has made the frontline soldiers in combating the deadly contagion to take a wait-and-see approach.
And that, as you have heard from the report, can sometimes lead to some side effects which keep people from work for some time. And therefore, together with the ministry and the Senate, we need to realize that it is a long haul that we shall be vaccinating because the population is large. As you can see, only 15,000 have been vaccinated among the healthcare workers. We have not even gone to the police, the prisons, and so on.
Already, the intensive care units are overwhelmed with the increase of the COVID-19 patients, with the Ministry of Health forced to direct that some may have to be taken care of at home. The chair of the Health Committee at the Council, Kisumu Governor Nyongo, has maintained that lack of enough resources and inadequate information on the vaccine has contributed to the slow uptake of the said jab.
And so far, so good. But I think the two things that have been mentioned in the report are one, that the pandemic requires extra resources to be responded to because the normal healthcare workforce is already overladen with the normal healthcare problems in the counties. And since this vaccination requires extra training for staff who will take off from their work to be trained, it requires extra time for vaccination. It requires also the staff themselves, the frontline workers, be vaccinated first.
This comes even as 9 countries from Europe have already banned the use of the vaccine, citing safety and efficacy concerns. The healthcare workers in the country have also said that they are awaiting to see if the country's top leaders will lead by example and get the jab. This even as several county heads have been inoculated by the vaccine to motivate the workers to get the jab.
Governor Martin Mambora, the chairman of the COG, has been vaccinated. Governor Anyang, the chairman of the Committee of Health of the COG, has been vaccinated. Governor Kahiga of Nyeri, the chairman of the Education Committee, has been vaccinated. I can count you several governors who have been vaccinated to give confidence to the vaccination process because we are, as it were, the commanders-in-chief of our health forces, health working forces in our counties.
I think that information needs to be publicized, Bwana Governor, so that you give confidence to the country.
Abdes is Ashim, Ibru TV.